Oh, absolutely. He and Sheldon Adelson are, without a doubt, some of the wealthiest guys in town. Let's welcome Andy Sealfon from RMS Medical Services.
Hey, Andy.
Hey, good morning, everyone.
Welcome to the zoo.
Where are the animals?
Well, let's see. Dave is in Virginia. Mike's in Vegas. Charles is in near Cape Cod, and we're in Port St. Lucie, Florida. So that's the location.
That covers the country.
That's the location of the animals. We're all over the place. So how was your trip to Europe?
That was quite interesting. Europe represents an opportunity and a challenge for us. There are some countries that are very advanced in Europe on this program of using for us in these countries.
I'm a little surprised that you're saying anybody in Europe is behind the curve. Really?
Well, the way they are doing it technically is not optimum for the patient.
Gotcha.
They are, some of the countries are in the old school where the doctors say, you do this, and you don't argue with the doctor, and he knows best. And the new models now, we educate the patient. We bring them part into the treatment protocol, and they can contribute to the treatment methods. And what that does is it ensures that the patient will stay on the treatment and get better treatment with less pain. And that means they get a better result. And so the treatment works better, and the patients don't get sick, and they don't need much hospitalization or more doctor care, and so on. A conference, the National Home Infusion Association conference. I was in Orlando, and at that meeting at Congress, we support the educational roundtable part of that group, which is direct training, credit training. You can actually, as a nurse, receive credits for this education.
Okay.
We also supported one of the drug companies with their morning hands-on education and training session for 2 mornings, where we combined with their drug and our pump, and we were there to support the training and education. We also had a scientific poster there, as well as we have our, obviously, standard trade show responsibilities, a trade show booth, and we meet with our partners in delivering these products to the market.
Right.
But it's very important that we do a lot of education. We also do a lot of WebEx training here on a monthly basis.
Okay.
We have schedules. And so this is a part of which I didn't wholly appreciate until I got to Europe, how important our education and training program is. It's part of what we do at RMS, and it's part of what makes our products work so well, is that we show the people and we explain and we educate them how to use it the best. And we get great results. And so part of the great results is we make a great product. But it's also apparently part is that we do a lot of education.
I think that's a great idea. You know, and the concepts, and of course, I'm attending WebExes now maybe 2-3 times a month from various television companies. And you're right. You cannot beat continuing education. You just can't, no matter what. And of course, when you have something like you've got, which is absolutely, I think, phenomenal, especially in the world of disasters or just areas where you don't have electricity. I think that's where your equipment comes in handy.
Well, it comes in handy for, a wide range of applications. Obviously, that was a factor in Europe when they saw that we didn't use batteries and electricity.
Yep.
They are looking at the concern there is renewable energy, not using energy, not having batteries to dispose of, chemical waste, medical waste are all big issues in Europe. It's very expensive to throw away this trash. And the fact that we don't use batteries, we're the original green.
That's right. I was just going to say, you're a green industry at RMS.
We are a green industry. We didn't recognize that either when they saw that they didn't need these lithium batteries, which are very problematic in terms of disposing of and, purchasing when needed and having one available when you're doing an infusion. Your battery goes dead in the middle of an infusion, you better have another one. And that never happens with our equipment. So that certainly is one of our benefits.
That's amazing. So now where did you go when you were in Europe? Was it Scandinavia?
Well, the first stop was Oslo, Norway. We
Okay.
met with distributors there. Then we went to Germany, meeting with a major distributor in Germany. From there, we went to Vienna to meet with a pharmaceutical company who's doing a trial. They were actually doing the trial in 3 countries, including Russia, but the trial in Russia, due to political reasons, is probably not going to happen.
You think?
And from Vienna, we went to Paris to meet with a major home care company. From Paris, we went to Stockholm to meet with the lady who invented subcutaneous immune globulin and published it in the 90s in the Lancet. A very interesting doctor, physician, and she impressed upon me the importance of the education component that I think we do pretty well, and maybe we need to do at least think about it more and promote it better, because we are the only ones in the device world who spend the effort, time, and money to do the education. Our patient brochures are top flight. Our training is top notch. And, it's one of the factors why we are as successful as we are.
It's incredible.
That is. You're right, Mike. I think it is. It's truly
and there's such an
amazing
opportunity
story.
in Asia which hasn't even gotten touched it yet because they don't have enough people to spread around the world.
Yeah.
Well, we have some big opportunity in Asia. The drug company that we work very closely with is having their drug approved right now in Japan, and we're on we have filed to have the Freedom 60 approved in Japan, and we are looking to find a distribution channel for Asia. It's big on our agenda.
Wow, that sounds great. Well, how long is the approval process in Japan compared to, say, America?
I think it's on a par with America. They have a completely different system, and we don't fit into their category. So it's a question of trying to figure out how to get us approved. There is not a particular category for precision mechanical infusion system in Japan. And so we're trying to figure out how do we get this approved. It's not a slam dunk because they don't know what guidelines, what regulations we need to fall under.
Well, is there like an FDA over there that?
Yeah, that's what we're talking. We have a consultant firm working with us with their healthcare agency in getting these devices approved.
Can't they just create a niche just for you guys in as far as that goes?
Yes, they can, but that takes a lot more time.
I gotcha. Okay. Wow. So, ballparky, when do you think the possibilities are for Asia? Because I think Mike's right. I think, my God, you talk about a slam dunk for you guys.
Especially the island countries that have earthquakes and mudslides, like the Philippines.
You bet.
Taiwan. The Philippines had a terrible situation in Tacloban, which is like a little island which was devastated with the cyclones, and they didn't have this product, and they really needed it.
Oh, sure. Yeah, I mean, yeah.
They all need it when disaster strikes. For sure.
No question. We can be a big help in countries that have difficulties maintaining their power grid. And we've seen it in our country. I mean, look at New Orleans and what happened when the power grid goes out. We've had it in Northeast United States. So this is really something that's worldwide now. And certainly Asia is a prime market for us. We're so busy trying to figure out how to do a great job in Europe. We're not able to do the entire world at one time.
Right, yeah. But,
yeah.
I mean, that's a whole growth process. You talk about Asia. Any progress at all, say, down around India at all?
We're talking to people there. We have contacts in India, in China, and we're exploring all of these areas. Right now, our main focus in Asia is Japan and maybe the Philippines. And our, we still need to do a lot of work right now because we have here and now markets in Germany, in France, in Italy, in Spain. And so we really need to look at those probably with equal intensity as Asia.
Well, now, okay, say that all of a sudden Asia comes on board. Of course, the next obvious question is, can you get product to them?
Yeah, we believe we can.
Okay.
We have been staffing up. We're expanding our operations here. We're looking at other ways of manufacturing. One of our meetings in Germany, for example, was with someone who can manufacture in Germany, possibly for us.
Okay.
And so maybe we do some of our manufacturing going to Europe, in Europe, and we don't have to do it in the United States, and that will free us, more capacity to handle other parts of the world. So we're looking at how best to expand.
Well, that's amazing. Charles, any questions for Andy?
Not really. Yeah.
Wow.
It's, I just think, the company just has to be more visible, and we'll start to see, the more action in the stock to the upside. The company's growth and everything is terrific, and clearly the story is, easily tellable and digested.
Oh, yeah. Yeah.
I mean, you're not talking about, producing in the medical field, producing a drug and having to explain how it works. And, you're not really talking about the nuts and bolts of the process. You're really only talking about what the net result is. And the net result is there are plenty of people in plenty of places around the world who don't even have the option of having power. So,
well, and
from that point of view,
as Andy mentioned, you guys up in the Northeast, were victims of that as well with Sandy last year. I mean, that all of a sudden was an eye-opener for all of you guys who've been looking at us with our hurricanes down here or tornadoes in the Midwest and just kind of going, okay. But then all of a sudden it 2 weeks without power or longer in the Northeast, and that brought things down to a standstill up there.
Oh, yeah. Yes. Where do we get more information on subcutaneous immune globulin? It seems like such a necessary product.
Well, it's a product that is enormously successful for treating immune patients, and there are many studies worldwide looking at it for for neurology, for neurologic applications. The neurologic applications are much larger and bigger. It takes more drug, and there are many, many more people afflicted. So there are many pathologies, polyneuropathies. There's multiple sclerosis. There are many illnesses that can be successfully treated with immune globulins. And if we can perfect how to do the larger volumes subcutaneously, it's going to be a godsend for those patients, and there are a lot of them.
Okay.
So there's a lot of upside potential for that market.
Okay, for folks who are tuning in and have never even heard that terminology before, let's go back to 101. What is that?
Subcutaneous.
Mm-hmm.
What happens is it has been found that when patients have specific immune deficiencies, they're missing immunoglobulins. That means that the body is not producing them effectively.
Okay.
And they are prone to be sick. They are prone to infection. They get frequent infections, frequent colds, frequent hospitalizations, frequent courses of antibiotics, chronically. Sore throats, strep throats, pneumonias, skin infections, but chronic, over and over and over. And when they're tested and they find out the immune system's not working, they have to replace those immunes. And those are replaced with an immune globulin G, IgG, which can be done today either intravenously or now the latest methodology is to put the drug in just beneath the skin into the subcutaneous layers. So you no longer need access to veins. Venous access is a problem because if you have a patient with primary immune deficiency who's prone to infection, you don't want to put them in a hospital and have the possibility of getting an infection while trying to get into the vein.
Sure.
The subcutaneous route, you can place the needles at home. It's much safer. It's less risk. There's less chance of an allergic reaction, practically unheard of in the subcutaneous domain. And so there's a lot of safety benefits. There's a lot of practical benefits to doing it subcutaneously. It keeps the blood levels very constant, so the patient is not prone to weakness and possible breakthrough infection because the subcutaneous route is administered weekly, and it tends to keep the blood level of immune globulins very constant. When you take it once a month, you get a surge in the bloodstream, and that can create a neuralgia, a flu-like symptom, nausea, vomiting, and that sort of thing, muscle aches, chills, fever, headache, all that, which is not very common in the subcutaneous. But it's a question what the patient prefers and what the patient needs. If you don't have venous access, subcutaneous is clearly the answer. If the patient's not getting a lot of reactions in the monthly dose, maybe that will work for them. But it's nice to have choices, and our system and our education provide a very fine, and we think medically superior option for patients who suffer from that. When you look at these other modalities, such as neurologic diseases, if it turns out to work well for those, and we believe it will, that means that we will have an expanding market because there's more and more we're noticing you're not going to get treatment in the hospital. It's too expensive. It's not long-term viable. So the hospital is going to push this into the home anyway. And so if more gets pushed into the home, it means home care has to be able to deliver all of these medications effectively in a home environment. It's better for the patient. It's lower cost. It's better health. It's better compliance. So we think this is a growth area for us.
That sounds amazing. Yeah. Is this covered by insurance, by the way?
Yes, Medicare, et cetera.
Okay. That's something. And the injections you had mentioned, are they monthly then?
The injections into the vein are monthly for immune globulins generally, or 3 weeks. It depends on the patient.
Okay.
3 to 4 week regimens or monthly are common. For subcutaneous, weekly is common.
Okay.
Now, there are some drugs that can be put in every 2 weeks subcutaneously, and people are moving to that. Some people do it more frequently than once a week, and that's also not uncommon.
That sounds great. Andy, what is your website address for those of us who want to really take a close look at you?
We're at www.rmsmedicalproducts.com.
Right,
and if they want information on the Freedom 60, we also have freedom60.com, which is our infusion pump system.
Right. Okay. And your stock symbol?
REPR.
REPR. That's pretty straightforward. Yeah, that's amazing. Michael?
That's a great story, and it's just need to get the information out. So many people need the product and don't even really don't know much about it.
Actually, immune deficiency takes about 12 years to get diagnosed. So people are living with this illness for years and years and years before it even gets diagnosed. So, yeah, a lot of people have it, and, yeah, a lot of people don't know it.
Wait,
wow.
Time out here. What? It takes 12 years to diagnose this thing?
Yes, that's correct. In other words, the patients have been sick for 12 years on average before they get a diagnosis. Oh, by the way, you're immune deficient. You should be taking IgG, immune globulin G. On average, it's 12 years.
That's amazing.
Right. I mean, Greg, there are a lot of things like that. I have a question for you, Andy, but I just want to make sure this to Greg first. You know, people who have Parkinson's typically don't get diagnosed for 3 or 4 years. There are lots of things that appear to be a flu, a severe flu.
Okay.
Even.
Yeah.
And you feel better, you don't go to the doctor. You feel worse, you say, I got better the last time. I'll just take the same over-the-counter medication and I'll feel better.
Yeah.
So, that's not that surprising. Andy, let me ask you something. Do you think, and I don't know if you really even know the answer, but I hear it a lot, are any of these immune deficiencies environmentally linked?
Well, there are some indications that might be a factor. There also, what may be more interesting is that the latest indications, and it's becoming a little bit known in the medical world, that what you eat may be causing this. There's something called the microbiota, and so there may be environmental in the sense of our foods have been adulterated, and what we are eating may be causing many of these immune responses, autoimmune responses. Parkinson's is autoimmune. MS is an autoimmune disease. Many of the autoimmune diseases may be a factor of the foods that we eat, and so significant dietary changes may improve these patients and may prevent and mitigate these kinds of what are called Western diseases due to the Western diet.
Wow. Well, that's an eye-opener.
Well, you think about it, Greg. I mean, the fact of the matter is that you can't treat the animals with all of the antibiotics or growth hormones or anything else of that nature without getting it into the population. I mean, that's what the whole move towards organics is all about.
Yeah. Oh, yeah. No, Ghazi Hodge will tell you that as far as, the beef and chicken that he buys for grill it. Yeah. No, it sounds so shocking, but I'm not surprised. I'm just not surprised. We've done so much genetic engineering along the way. You just think, wow.
I mean, do you think that it's any surprise that the generation before us was physically smaller, and the one before that was physically smaller than that? When you're pumping steroids into all of the meats that we eat, I mean, you don't have to be a genius to see the link there.
It may be something even more simple than that. It could be the sugars and the carbohydrates we've added to everything in our foods. And there may be combinations of things. We tend to eat foods that have less fiber in them, much less fiber than our ancestors ate. We eat a much more heavily grain-oriented diet. So there could be all of these factors, plus the hormones, plus the additives, and so it's hard to know which are the major contributors and which are the minor contributors. But the food we eat may play a role in all of these conditions, and that would be really an interesting future for us.
Yeah. I don't think interesting is really the word, but no matter what, Andy, you guys at RMS Medical are going to be there to help us out.
How about disturbingly interesting?
Yeah, I think you're closer, Charles. Holy smokes. Well, Andy, best of luck to you. Are you,
Thank you.
Pretty much staying at home for a while, or are you going back to Europe?
I would sure like to, but who knows? We have a lot of ground to cover.
Yep.
So
yep.
We go where we need to go.
There you go. Hey, well, good luck to you, and good luck to everyone at RMS Medical.
Thank you very much. Have a great day, everyone.
All right. Andy Sealfon at RMS Medical Supplies.
REPR is the symbol. Very undervalued stock. A great company. They've been around a long time. It's got a steady growth and steady sales growth.
Yeah, and of course, seeing that we're not taking care of ourselves the way we should, we all may be using that product at one time or another. You know, I hate to joke about it, but you know, it's very intriguing that Andy talked about diet. I mean, you hear that with diabetes docs all the time. You know that watch your diet. You know, and if you lose weight and watch your diet, you're going to go along